Good morning. Well, good afternoon. Happy Thursday to you. It's a Throwback Thursday. My name is Paul Brumbaugh, and you're on the edge. I'm sitting here in downtown San Francisco, Edge Studios to be exact, and I'm just hanging out, seeing what you guys are up to. Thought I'd read you the latest, greatest. The Supreme Court on Thursday blocked Biden's administration from enforcing a requirement that employees at large businesses be vaccinated against COVID-19 or undergo weekly testing or wear a mask on the job. Okay, so again, the Supreme Court blocks this. At the same time, the court is allowing the administration to proceed with the vaccine mandate for most healthcare workers in the U.S. The court's conservative majority concluded the administration overstepped its authority by seeking to impose the occupational, the Occupational Safety and Health Administration's, better known as OSHA's, vaccine or test rule on U.S. businesses with at least 100 employees. More than 80 million people would have been affected. OSHA has never before imposed such a mandate, nor has Congress. Indeed, although Congress has enacted significant legislation addressing the COVID-19 pandemic, it has declined to enact any measure similar to what OSHA has done here. The conservatives wrote in an unsigned opinion, the dissent of the court's three liberals argued that it was the court that was overreaching by substituting its judgment for that of health experts, acting outside of its competence without legal basis. The court displaces the judgments of the government officials given the responsibility to respond to workplace health emergencies. Justices Stephen Breyer, Elena Kagan, and Sonia Sotomayor wrote in a joint dissent. When crafting the OSHA rule, White House officials always anticipated legal challenges, and privately, some harbored doubts that it could withstand them, driving millions of people to get vaccinated and for private businesses to implement their own requirements that are unaffected by the legal challenge. Both rules have been challenged by the Republican-led states. In addition, businesses groups attacked the OSHA emergency regulation as too expensive and likely to cause workers to leave their jobs at the time. And finding new employees already is difficult. The vaccine mandate that the court will allow to be enforced nationwide covers virtually all healthcare workers in the country. It applies to healthcare providers that receive federal Medicare, Medicaid funding, potentially affecting 76,000 healthcare facilities, as well as home healthcare providers. The rule has medical and religious exemptions. Earlier on Thursday, Biden announced plans to send 1,000 military medical personnel to hospitals and medical facilities. The president said on Thursday as he announced the plans to purchase another 500 million at-home COVID tests. The military members will begin arriving in the states across the country the next week amid a surge in cases largely attributed to the Omicron variant. This week, a top government official admitted it was likely that most Americans would be infected with the coronavirus. On Thursday, a U.S. recorded a record number of hospitalizations due to COVID-19 as daily infections soared for more than 1.35 million. A test kit shortage across the country continues to hamper efforts to control the Omicron variant, but a silver lining has emerged, with signs that the Omicron may be peaking in parts of the Northeast. In New York City, the number of cases has flattened in recent days. The New York Times reported, while New Jersey and Maryland have seen a slight decrease in the number of infections. Every case is one too many, but if you watch the trend line, it looks like we may be cresting over the peak. Governor of New York said in a briefing this week. We are not at the end, but this is a glimmer of hope we desperately need. Speaking at the White House on Thursday, Biden said his administration would double its order of home test kits, which would be delivered free of charge to America's to 1 billion. Okay, so here's the thing. I heard that they're going to roll out these things too, but we have not seen actually any rollout of how they're going to get these to underprivileged families and stuff like that. So I'd like to know how they're going to do that. Says Biden said a website where people can request the test will launch next week. The president has also announced that for the first time, his administration was planning to make high-quality N95 masks, which are most effective at preventing transmission of the virus, available for free. The 1,000 members of the military will help mitigate staffing crunches at hospitals across the country, Biden said, with many facilities struggling because their workers are in at-home quarantines due to the virus at the same time as COVID-19 cases have surged. They will supplement the more than 800 military personnel who have already been helping civilian hospitals since Thanksgiving, and the more than 14,000 National Guard members who are assisting with testing and vaccinations. This week, Janet Woodcock, acting as the head of the Food and Drug Administration, said that most Americans were likely to contract coronavirus. I think it's hard to process what's actually happening right now, which is that most people are going to get COVID, all right? Woodcock said. Biden has also announced that 6 additional military medical teams will be deployed to hospitals in Michigan, New Jersey, New Mexico, New York, Ohio, and Rhode Island. The U.S. leads the world in daily average number of new infections reported, according to 1 in every 3 infections reported worldwide. That's according to Reuters. All right, guys. Thank you very much for tuning in. I appreciate you. My name is Paul Brumbaugh. Keep standing up, and we'll see you next time here on The Edge.